third part of our series on pharmacokinetics is entitled Factors of Individual Variation. The information pulled from this is coming from Chapter 2 as well as Chapter 3. So if you're matching this up with the notes that you took in the margins of your book, you're going to be prepared to look at both Chapters 2 and 3 as we're going through this portion of the lecture material. So your objectives for this particular module is, number one, to list individual variations that affect drug administration, to describe factors that affect the absorption, distribution, metabolism, and excretion of drugs in the elderly, and to define terms that are related to chronic drug use and abuse. So when we're talking factors of individual variation, we've got to keep in mind that slide from way back in the first unit of pharmacokinetics, when we said that everybody's bodies are a little bit different. So we're going to start looking at some of these individual factors that can affect how a medication is processed through the human body. The first factor we need to look at is that of weight. Medications are calculated on average weight. So thinner people may need less of some medications. Heavier people may need more. Another factor that affects medication administration is that of sex or gender. Females have a higher body fat and a lower percentage of body water than males. So let me repeat that. Females have a higher body fat and lower percentage of body water than males. As a result, water-soluble medications, that is, medications that dissolve in water within the body, may have a greater effect on females than males. And fat-soluble drugs, drugs that deposit in the lipids of the body, may stay around longer in a female body than in a male. So we need to keep that in mind when adjusting medication doses for men versus women. Genetics, those things you've inherited. Some of us genetically process some medications and some people don't. Usually this is related to the enzymes that your body has inherited. One of the biggest ones that we see an issue with is anesthesia. The enzymes that process anesthesia in some families are missing or are not as predominant. So we need to watch that when prescribing medications. A person's emotional state can affect how medication works within their body. For example, someone who's very anxious or excited may metabolize medications faster and therefore may require more medication. Just the opposite, if someone's depressed, they may metabolize them slower and they may hold on to medication longer. Compliance can be a huge factor. If someone isn't taking their medications, they're not going to be as effective. Or if they are not taking them in the way they're supposed to be taking them, they're not going to be as effective. And then the last piece we need to talk about is that of age. Age changes the way medications are utilized by the body. Remember that our pediatric clients are kids. They're not just little humans. So as a result, medications need to be adjusted for their size and body mass. The most typical way we adjust medications for our pediatric clients is through by administering them by weight. So we may administer them by so many milligrams or so many micrograms per kilogram of weight, so that we adjust accordingly to their body mass. In the second half of this module, you're going to be working with dosage calculations, and you'll get to see how that factors in with our pediatric clients. And then our geriatric clients also have a unique set of needs, and that's what we're going to spend the next section of time talking about, specifically how our geriatric clients So in the process of pharmacokinetics, when we're talking about absorption in the elderly, we need to keep in mind that with age, there is a slowing of drug absorption, and subsequently there becomes a delay in drug onset. So while the peak drug level may be lower, the total amount of drug absorbed is not significantly affected. So elderly people have decreased blood flow to their intestines and a decrease in gastric acid secretions. And as a result, the drug absorption can get slowed, and you will see the onset being delayed of a medication. Now, looking at the process of distribution in the elderly, we know that as people age, they get a decrease in the amount of lean body mass, less muscle tissue. And they also get a decrease in the total body water and an increase in body fat percentage to what they've had previously. So what happens is distribution gets affected in that they usually end up needing, in this case, may require a reduction in their dosage because of the change in their body mass and an increase in their body fat. Also can be dependent on whether the medication is water soluble or lipid soluble. Again, if they have a decrease in total body water and we have a water soluble medication, it's going to stay in their body longer, decrease the dosage. If they have more body fat and the medication is absorbed by the fat, they can hold on to more of the fat, and again, we need to decrease the dosage. So we talked about absorption, distribution. What about metabolism? Well, with aging, metabolism slows down. So you see decrease in blood flow to the liver. We see a decrease in the production of enzymes which metabolize things. And so as a result, the drug can stay in the body longer than we would see it in someone who was, say, 30 or 40 years of age. Again, may require a decrease in dosage. And then the last part of that process is excretion. As many of us are well aware, there's decreased blood flow to the kidneys with age. Decreased blood flow to the kidneys means things are going to filter out slower. And overall, the entire urinary system slows down. So as a result, drugs are not eliminated as quickly from the body in an elderly person as they would be in you and I. So again, we're looking at the possibility of decreasing dosages for an elderly person when we consider the fact that their kidneys one of the primary sources of elimination may be affected by their age. So overall, when you look at this, you can see all four of the processes of pharmacokinetics are affected significantly in our elderly population, meaning we have got to monitor them very closely with the medications they're on. Also knowing that most of them are in the state of what we call polypharmacology, meaning they're taking a multitude of medications. We need to monitor them very closely for that fine line between therapeutic and toxic, which, as we've talked about before, is only controlled by the dosage. The dosage can take someone very quickly from a therapeutic range to a toxic range. The last topic then that we have within our unit on pharmacokinetics is a little bit of a discussion here on chronic drug use and abuse. Many of these terms you are probably familiar with, so I'm just going to briefly do a review of them for you. In the case of tolerance, this means that someone over time, taking medications over time, becomes tolerant of the medication. In other words, it doesn't seem to have as great effect anymore. So as a result, they need more of the medication in order for it to have its therapeutic effect. Dependence can occur over chronic drug usage, and this can be either physical or psychological in nature, where the body now needs to have the medication to feel normal. So physically or psychologically, the person needs to have the medication to feel normal. And then that last term is that of addiction. And there's a fine line between dependence and addiction. What usually distinguishes them is that addiction is accompanied by compulsive drug behavior, whereby someone will go and do anything they can, whatever they need to do, to get the medication. They've become that dependent that now they're compulsively, it takes priority in their life over other things in their life. So at this point, we have added on some individual variations and some variations specifically to deal with our elderly population, and then a little bit of discussion on terms. So here's a question for you. Just to think about, you don't need to email it back to me, just to kind of think about, in the perfect pharmaceutical world, what does the average adult weigh? And how does this compare with the individual variations that we just discussed? Now, I will tell you, in the perfect pharmaceutical world, the average adult weighs 150 pounds. So medications are calculated on an average of 150 pounds. So just think through how that compares to the things that we have just discussed. Your assignments for the pharmacokinetics portion of this module are to review your notes that you took from Chapter 2 and that little bit Chapter 3 on the elderly, and then complete your drug summaries through the drug summary form for the following medications: cardizem, Norpace, Inderal, Lanoxin, and Nitrostat. So what you'll want to do is take those 5 medications, do your research, look up your information on them, pull up that drug summary form, and then complete it for each of these medications. One form for each medication. And this will be our lead-in in your research for our next modules, which will deal with cardiovascular medications.